Montano, and I'm going to be talking to you guys about ovarian cancer. First things first, the female reproductive system. The female reproductive system contains two ovaries. Ovaries are responsible for the storage of eggs, also known as ovum or germ cells. They can also produce hormones such as estrogen and progesterone. You see, there are ovaries on either side, fallopian tubes, the uterus, cervix, and then the vaginal canal. What is ovarian cancer? Ovarian cancer is a type of cancer which originates from the ovaries, defined by uncontrollable growth of abnormal cells in ovaries, which can vary by type and stage. These cancerous cells continue to multiply and outlive normal cells, which will then form a tumor. There's a picture of the tumor here. There are more than 30 types of cancer that can be broken down into three main categories of ovarian cancers. The first, surface epithelium. It originates from the outermost tissue layer of the ovaries. This makes up about 90% of ovarian cancers. The second, germ cells, originate from cells that produce eggs. Most are benign and it can occur mainly in younger women. And the third, stromal cells, originates in hormone-producing cells and normally diagnosed at early stage compared to the other two types. This makes up about 7% of ovarian tumors are stromal. Stages of ovarian cancer. We have stage 1, cancer is confined to one or both ovaries. Stage 2, cancer spreads within the pelvic region. Stage 3, cancer spreads to other parts of the body within the abdomen. And stage 4, cancer spreads beyond the abdomen to other body parts. Some risk factors for ovarian cancer. Age. Most common is women in menopause around 50 to 60 years old. Genetic disposition. Genetic mutation called breast cancer genes 1 and 2. Family history. Those with 2 or more close relatives with ovarian cancer have an increased risk. Uterine, breast, and colorectal cancer history, due to increased risk of family cancer triggered by inherited genetic mutation. Having children older or never having children in the first place. First full-term pregnancy over the age of 35 and never carrying full-term pregnancy at higher risk. Using fertility treatments such as in vitro increases the risk of ovarian cancer. Taking hormone therapy after menopause, and early menstruation, late menstruation, or both. Symptoms and treatment. Early stage ovarian cancers rarely cause symptoms, but some symptoms would be abnormal bleeding, quickly feeling full when eating, weight loss, discomfort in the pelvis area, changes in bowel habits, frequent need to urinate, and constipation. Some treatments: surgery to remove one ovary, surgery to remove both ovaries, surgeries to remove both ovaries and uterus, chemotherapy. Chemotherapy is often used after surgery to kill any cancerous cells that might remain. It can also be used before surgery. Target therapy, which uses medications that target the specific vulnerabilities present in your cancer cells, or supportive care, or palliative care, is specialized medical care that focuses on providing relief from pain or other symptoms of serious illness. Prevention. There's no sure way to prevent ovarian cancer, but you could consider taking birth control pills. It may reduce the risk. Discuss risk factors with your doctor. Example, family history or deciding to meet with a genetic counselor. Incidence and prevalence among ethnic groups. Non-Hispanic whites are most at risk of getting ovarian cancer. Non-Hispanic blacks and Pacific Islander and Asian are the least at risk. Hispanic and Pacific Islander have the lowest mortality rates. All ethnic groups vary little in numbers per 1,000. It is responsible for everyone to get checked. Thank you.